Welcome to Conversations on Healthcare. This week we welcome Dr. Deborah Birx, former White House COVID advisor under President Trump, on her new memoir, Silent Invasion, about mistakes made addressing the pandemic and how hundreds of thousands of deaths could have been avoided. Now, here are your hosts, Mark Masselli and Margaret Flinter.
During our guest's time as White House coronavirus response coordinator, the press noted that she was careful to never openly criticize President Trump or his administration. But now Dr. Deborah Birx has had time to reflect and share her thoughts in her new book.
Dr. Birx is a highly regarded infectious disease expert. She's the author of Silent Invasion, The Untold Story of the Trump Administration, COVID-19, and Preventing the Next Pandemic Before It's Too Late, published by HarperCollins.
Well, Dr. Birx, thank you for joining us. But before we get to the book, we start with the news that Vice President Kamala Harris has tested positive for COVID, and the press has noted that this news is in conflict with the Biden administration trying to present a calm image about COVID. What are your thoughts about the vice president's situation and how it relates to overall to what the administration is trying to communicate?
Well, I think it illustrates our very dilemma right now. She was vaccinated, boosted, and then reboosted just a month ago. And I am sure she will do incredibly well. She has access to all of the really critical therapeutics. And I think that's part of the reason why I wrote the book. I could see people trying to make it seem, as people who lived in rural areas, that they were getting sicker because of how they voted. And I think what you have realized in setting up your clinics across Connecticut, it's an access issue. And our rural healthcare is very much diminished and very much similar to what I encountered in sub-Saharan Africa 20 years ago. People just do not have access to top-line medical care. I applaud them expanding access to antivirals into more pharmacies. If you had looked at that site a week ago, you would have seen about 10 sites in Oklahoma and 10 sites in Nebraska. That is not going to meet the needs of the people in the rural areas.
Yep.
Well, Dr. Birx, your book certainly addresses the very tough times, and that's an understatement, that we all went through starting a little over 2 years ago, and gives you a chance to set the record straight. But I'd like to, if I can, go to a 2020 New York Times report that said that in mid-April of that year that you would roam the halls of the White House, sometimes passing out diagrams to bolster the case that COVID had peaked. Even Speaker Pelosi reacted negatively after that news came out. Looking back, what did that report get right or wrong?
Well, the only right part in that report was that I made extensive graphics every single day. So when I got back to the United States from sub-Saharan Africa on March 2nd, there were no really comprehensive data streams coming into the federal government. We couldn't see any of the laboratories. We couldn't see any of the hospitals. Less than 40% of the hospitals were doing any type of reporting. So we took a while to assemble all of the data. Many of the private companies helped me. We called them to the White House at the beginning of March, and they set up testing. Finally, I asked all the commercial laboratories that I knew well from my work in sub-Saharan Africa and Asia just to develop COVID tests for the average American. And within literally working around the clock, within 3 weeks, they had tests rolling out across this country. Imagine if that had happened in January. But two of the main company that was providing tests, Abbott and Roche, they were providing me the nightly reports coming off of their instruments. And I can tell you what it was like to receive those reports and see Columbia Hospital reporting 42% test positivity, to see NYU Langone reporting 52% test positivity, having run hundreds of samples. And so it was very clear that we were well into just dramatic community spread. And so what the graphics represented was an integration of cases and test positivity and hospitalizations. And that particular, I wrote it every day. So every single day, every cabinet member, the cabinet members, the members of the task force, senior leaders in the White House got a summary of the pandemic and graphs. So I don't go skipping through the halls of the White House. I was actually underground next to the Navy mess, but I distributed those graphs every day, not skippingly, but through the internet, through emails. And in that particular, what they're referring to is April 11th, because I asked them, what are you referring to? And I pulled up, of course, April 11th. And it said that I believed the cases had peaked in the metro area of New York, but were expanding in Boston, expanding up through Connecticut, expanding in Chicago, expanding in Detroit, that Houston was very concerning, and several major metropolitan areas that had entered exponential growth. So I guess if you only looked at the first bullet point, that things were beginning to stabilize 6 weeks in New York, you could have ignored the rest of the report. But I will tell you, they were all the same font size. So each of my bullet points, I don't just emphasize where things are improving. I'm very critical of my own use of data, and I make sure it's comprehensive.
Well, thanks for that clarification. And there was a lot of fascination about you and your time in the White House. Some saw you as too deferential to President Trump when he was in office, and some say you may still reflect some of those views in your book. And you write that Donald Trump looms large, to be sure, but the scale of what occurred in 2020 was far greater than even him. And you write there was no one scapegoat, yet polls in 2020 show a clear majority of Americans rejected Trump and his approach to COVID. You even said that more than 130,000 American lives could have been saved if Trump and the Republican governors had acted differently. I guess the question is, why won't you lay this at Trump's feet in your book?
Yeah, so in the book, I'm very clear about what went terribly wrong, so we don't have it happen again, and what went right. I'm just going to roll that back with when you talk about the Republican governors, because I spent a lot of time across the South in the summer surge with the Republican governors, and 100% of them mitigated at the level that I requested. So, and that was the important piece to me. When you met face to face, when you were around the table, when you were looking at their reality on the ground and understanding their situations, I didn't have any Republican governor that I went to visit refused to do the mitigation that we were recommended. And indeed, I learned from them. And that was the other piece of going out. But I guess if you're taking that from the book, not really reading the book comprehensively, because the whole point of the book was to show that I learned from people who shared my views, and I learned from people who didn't share my views. And that's the problem. If we come into everything with a perception that he's Republican and I can't listen to him and I can't learn from him, or he's a Democrat and I can't listen to him and learn from him, we all have a tremendous problem. And that's why I wanted to make it clear that one of the most successful programs in the United States that was funded by the federal government, PEPFAR, went through multiple presidents, 4 presidents now, 10 Congresses, both with Senate majority that were Republican and Senate majority that were Democrat, and House majority speakers that were Democrat and House majority speakers that are Republican. And I think I was hoping that the book showed clearly what President Trump had really difficulty with, and I clearly stated these things were wrong and they hurt the pandemic, particularly related to communication. But on the other side, I think that White House allowed us to work in a way with the private sector that had never been done before, and that resulted in tests, therapeutics, and vaccines. So, you know, you can't make this into a one-dimensional, uncomplicated plot. It's a very complicated piece, and that's why it took 500 pages to explain it, because I really wanted people to understand what has to be fixed and what we should really learn from.
Great.
I'm deferential to every single president of the United States. I've worked with every single one since Jimmy Carter. You could ask them if I was respectful to them. I didn't always agree with what presidents were saying, but the presidents were elected by the people of the United States. And in my mind, that required a level of respect. I treat African presidents and Asian presidents and prime minister with that same level of respect. I find if you work with people coming from respect, you can get much more done.
Yeah.
Well, thanks for that, Dr. Birx. And also, I'm glad for your talking about PEPFAR. I'm not sure enough Americans really understand what a great piece of work PEPFAR has been internationally around addressing HIV/AIDS. You know, you talked about the experience of presidents, and experience is a great teacher, we hope. And I think former President Trump, who may be president again in an imaginable future, had the experience both of leading the country through the first pandemic in 100 years, being right in the heart of things, and also the experience of being sick, right? Had COVID himself during that phase. If he were to be back in the White House and you kind of, imagine that future, what do you think he would do differently? What would you hope that he learned from this experience that would guide him as a president in the future in COVID or in pandemics that might come down the road?
Well, I've never understood or spent enough time with President Trump to really answer that question for you. I hope as a country, we do three things. I hope we create a national transparent database where all community-acquired infections are tabulated and very clear down to the most granular level by age and sex and race disaggregation that still reflects and respects HIPAA. I think there's a clear way to do that. We did that in sub-Saharan Africa. Data transparency drives trust. And I think if every American could really see what was happening in their community, seeing how these components of COVID interact from early community spread in younger age groups, gradually making it to the vulnerable community members, making it clear how many people over 70 live within their community. We have 35 million Americans over 70, only 1.5 million live in nursing homes. So majority, 90+% of our individuals most at risk for this disease are in communities. And so I talked about access, barriers to care. If we don't use that data like we did in PEPFAR to identify the gaps, find the solutions, overcome access and barrier issues, and use that data to educate people on their risk and their needs, and the need for testing and masking and their needs for access to antivirals and monoclonals, we're going to continue to have deadly surges. And I think we're at a place where we have the tools that all Americans can survive and thrive in a time of COVID, but we are not still using the tools effectively. So I'm hoping that long before 2024 and a new election, that we have the systems and the agencies and our federal institutions working in a different way and data available to every American so that they can make a really clear risk assessment of what they need to do to protect themselves. I think the illustration of the vice president is very clear. People get infected despite full vaccination and boosting. If she was someone over 70 with multiple comorbidities, we know that a significant number of individuals are still hospitalized that were vaccinated and boosted, and we know that some of them succumb to COVID. We have to change this, and we know how to do it, but we need the will, and we need the federal political will to actually make it happen. So I'm hoping all of that happens long before 2024. We're going to continue to have these surges, and so we cannot wait till 2024 and hope that President Trump is different if he was reelected.
Yeah. You know, you've really laid out a clarion call for sort of reform and the things that really should be focused in on. And you're now introducing, going around making the circuit around your new book, and congratulations. Talk to us about the struggle that you're having, because obviously people are looking at this through a political lens, right? Whether you were for the last president or against the last president, how much do you think you can get your message across? Because it is so important We're seeing this spike again in infections, in hospitalizations, up 4 weeks in a row in New York State. This is really serious stuff. And I'm wondering if you could just share a little bit about the struggle you might be having of trying to get the noise out of the room and have people really focus in on the seriousness of this problem and the actions that need to take place.
Well, I think one of the things that has concerned me the most watching these last 2 years is, I think, as a federal civil servant, as someone who spent 29 years in the military, as someone who served every president with respect, that because I went in the White House for a year to help our COVID response, that I have been interpreted as a political human being. I never campaigned. I was never politically appointed by President Trump. I was retained after being appointed by President Obama. The fact that I'm having to break through that blue-red divide, that's going to pale how civil servants look at working at a high level with politicals. And I think people know that I had never made my politics known, even today. So, which was important in the military. You couldn't go around saying, and there's the hat jack. So I took all of that very seriously. So no one could have really told who I was voting for or what I was doing. I think this is a very unfortunate situation, and that's why I spent a lot of time in the book. About half of the book is about what was going on in the White House, but half of the book is about what I learned being in the states, what I learned from governors and mayors, what I learned from the tribal nations, what I learned from people who were working in rural areas and on tribal nation reservations to really tackle this pandemic. Those are what American people need to see. And I think the other really amazing thing was going to over 30 universities and seeing how many university presidents and student bodies figured out how to open safely. And we're fully open in 2020, in the fall of 2020. And so I think hopefully the book is a wake-up call for people to actually learn what we need to do and we need to do differently. I think after 9/11 and the 9/11 Commission changed how we gather intelligence in this country and how we share among the agencies. Public health and response to pandemics don't belong to any one agency. And I think we need that same approach of really being willing to look at ourselves and see where we failed and failed the American people and fix it. This is bigger than who's in the Oval Office. Certainly who's in the Oval Office can really impact communications, and communications is critical. So I don't want to make light of that. I talk about it in the book a lot. The mishandling of communications by the Trump White House caused significant issues on the ground, no matter what state I went into, and caused amazing confusion among the American people. And so that has to be fixed, and there has to be consistency there. But we also have to have a safety net that says every American ought to be able to see the data themselves. Yeah. That's what we did in sub-Saharan Africa. All the PEPFAR data is public. All of it is on pepfar.gov, down to the single site serving small numbers of clients, because we want to make sure no matter where you live, that you can have the ability to be virally suppressed and thrive with HIV. So we want the same in this country with COVID.
So Dr. Birx, I hear such resounding themes around communications, around access to services. And, personally, I think it was a great thing to see everybody being able to get a COVID vaccine, regardless of their insurance status when we got to that point. That was a great moment. We'll look at a bright side there. But the third theme, in addition to communication and access to services, is really data. And certainly the Center for Disease Control is working hard to speed up data reporting and its processes. I think it's been well reported, and you've said yourself you were frustrated with the availability of data. I think that includes CDC data. I think, most of us were kind of surprised that CDC didn't have the kind of robust, timely daily data feeds coming in that I just imagine that they did. And I wonder, what's your advice if you were asked for it or offering it? What's your advice to CDC about what they need to do to get that input coming in from all points around the country, the way you were trying to do as you did your work in the White House?
Well, first and foremost, ask people. Because when I saw this all the time in tackling pandemics around the globe, people decide that no one will do it. They self-edit, they don't ask. I went to all 6,000 hospitals and said, I need your daily admission data. It's nice to know how many people are in the hospital, but that doesn't give us any knowledge about where this pandemic is headed, how bad it's going to get in your area, how much human capacity you need, and how much we're going to need to support you, and how many supplies I'm going to have to surge to you, including treatment. So we were not only collecting very little data, we were collecting the wrong data. And I think this really shows that you have to prepare for all types of pandemic, not just the pandemic you want to have. And I think for decades, CDC prepared for a pandemic based on symptoms and tracking people by symptoms. And in this 21st century, every single disease should be diagnosed laboratorily. We do that for diabetes. We do that for hypertension, for your cholesterol. We don't have people come into your clinic and say, I think I have diabetes. And you say to them, oh, what are your symptoms? Oh, I'm going to give you meds now. No, you would get their glucose, you would get their hemoglobin A1C. And here we are deciding if people have flu or RSV or adenovirus based on symptoms, when we have the capacity to do this kind of sophisticated testing, obviously, because we were able to go from no tests to 1 million tests within a matter of months. So we have to, and it just doesn't belong in the CDC as a country, there needs to be a public-private partnership around this data. That data needs to be transparent. The hospitals and clinics have the data as well as the laboratories. No one has to have a separate data submission to the CDC that's just duplicative and causes unbelievable amount of additional work. There are already, all of this information is available electronically. What we need to ensure is CMS only pays for definitive diagnosed diseases when it comes to infectious diseases. And then we would know who had flu and who had COVID, and all of that data would be available. And so there are some simple fixes. Obviously, that's what the 9 pages at the back of the book are that really ask Congress to look at this. I think CDC has to get out of that mindset that there's public health and then there's health. There's just health. Yeah. And we need to use health data to tackle the pandemics that we have of obesity, opioids, TB around the globe, and also hypertension and diabetes in our own country, and use data in real time to improve each of those pieces. People told us that we would not be able to change the pandemic around the world in HIV, and we did. And now you do it through data. You don't do it through thinking that this is what's happening. You actually document what's happening and who's at risk and whether you're reaching them. And that's where you find what you've done. You saw the need, you saw the access issue, but you don't stop with one clinic. You look where there's still a need. I mean, you use data to find the patients who need to be served. They don't show up in your data until you go and find them and make access available. So this is the kind of work that we need to do. But I can tell you, after 20 years of tackling HIV, TB, and malaria, it is possible to change pandemics. And we have the luxury of having a vaccine and effective therapeutics. So we have the tools, but we have to utilize them in a data-driven way.
Well, data-driven decision-making is so important, coupled with good communication. And in that context, let's discuss a current challenge we're seeing at our community health center, and I know other health centers around the country. Less than 40% of patients who've received the COVID vaccine have returned to get a booster. And I'm wondering what your thoughts of that we can do better or differently based on your experience in communication and reaching out to those individuals.
Well, first and foremost, we have to be honest. And I think there was a lack of honesty about what these vaccines can do and can't do. They were never measured to prevent infection. I want to be very clear about that. We did not test people weekly in that phase 3 trial to see who got mild and asymptomatic disease to cite vaccination. We didn't do that. We were only tracking in those trials symptomatic disease, and the comparison for efficacy was severe disease and death. And so, number one, we should have, when we put these vaccines out there, is tell the American people, we don't know how well this will prevent infection. We think it's going to be very effective against severe disease and hospitalization and death. But because we don't know about infection, don't assume because you got the vaccine that you are now invincible and Superman and protected from COVID-19, because we don't know. And I think if you had put the data up day after day and collected the information on breakthroughs, which were very evident in June of 2020 in the southern surge, of June of 2021 in the southern surge, if you had constantly been making the American people aware about the waning protection against infection, the waning protection against hospitalization, and the waning protection against death, and you made that available and understandable in real time in graphic form, county by county, state by state, community by community, people would have known and they would have seen the reason to get a booster. Now we went out there and said this is a miracle. It was the speed of it, but it had limitations, yet we ignored them. And now we expect the American people to wake up and realize that they weren't told the complete picture. And so when we talk about fractured trust, it's fractured trust because we're not being crystal clear to the American people about what things happening and what things aren't happening. I mean, the fact that we're coming out with data now that says 50% of the people hospitalized in January were fully vaccinated, that would have changed people's strategies for protection if they had known that. It definitely would. But now we're telling them the end of April when one of the most deadly surges has already passed through the country. These surges are predictable. This late spring surge happened last year. It was the Alpha variant. Highly predictable, was very much isolated to the Northeast and upper Midwest, although it did go down for a few other states. It was primarily concentrated in the upper Midwest and the Northeast, just like this late spring surge. We should be preparing right now for a summer surge and putting the data out daily with clarity to the American people about who's being hospitalized and how you're going to address those gaps. Every hospitalization and death at this point is a failure. And we need to dissect each and every one of those so that we're finding the solutions to prevent it in the summer and the winter when we know there will be surges.
Well, to put it mildly, I think there's a lot to unpack in those comments you just made that will keep our listeners perhaps replaying that answer about the data and the messaging for quite a while. But Dr. Birx, I noted you mentioned the tribal nations in your work all around the country during your time and your role in the White House. And your book has an important chapter about the tribal nations that you felt really demonstrated the powerful role of community in curbing spread, despite the fact that they don't have the strongest healthcare system. Tell us more about that and your perspective on what the tribal nations were doing that you thought was so powerful and effective.
The tribal nations communicated continuously and presented the data. So they presented the data about test positivity and where this virus is and why they're at the highest risk. People talk about Black and Brown, Hispanic, and African Americans, and they always leave out the tribal nations. The tribal nations have the highest case fatality rate that in any population in the United States. And they knew that because they were collecting their own data. They were given inadequate testing. They are often far removed from health centers. And so what they had was a sense of community, and they utilized that sense of community to protect one another. And I think the same thing happened at many of the universities and schools. The student body came together to really help other students, focused on mental health, and really ensured that students could survive because they had a different set of issues. But that's what I want people to take from the book, is we have solutions in this country that really show how to communicate. And I think the other piece that was really important that we haven't done is the behavioral research to understand vaccine hesitancy. It's very frustrating to me that we collect data on things and then we don't do anything to change the number. And just year after year, we say flu vaccine uptake is less than 50%. It's worse among Black and Hispanic populations, and we did nothing. So we got to collect data and fix things.
Well, thank you, Dr. Birx. And COVID is an evolving story. Your book is an important part of the history. And thank you for your decades of service, not only in the PrEP-FAR, HIV, AIDS world, but also with COVID. And thanks to our audience for joining us. You can learn more about Conversations on Healthcare and sign up for our email at chcradio.com. Again, thank you, Dr. Birx.
Thank you. And I appreciate, so I looked into everything that you were doing, starting with 1, becoming 200. You don't do that unless you're data driven, and you saw a need and you found a solution. And this is what we need all the way across the country.
Well,
so
that's
thank
great.
you.
Again,
Thank you,
congratulations,
Dr. Birx. Thank you
and thank you so
us.
much.
Bye-bye.
Bye-bye.
Bye.